Hello and welcome to this brief webinar for Interfaith Senior Programs of a Collective Impact 101 and an overview of Find a Ride Waukesha County. My name is Ben Williams and I'll be walking through these sessions today. Our purpose is to provide a general overview of collective impact and its terminology to make sure that we're speaking the same language when we're thinking of the different words and what they mean. And then introduce a specific collective impact initiative in Waukesha County that Interfaith is playing a pivotal role in. Find a Ride Waukesha County. So beginning with Collective Impact 101, I think it's best to start with a common definition. Collective impact is the commitment of a group of important actors from different sectors to a common agenda for solving a specific problem. There are a few key things here to call out. One, important actors from different sectors, so it's not all just from one area, with a common agenda, meaning that they understand and look at a problem from the same lens and have a shared vision for how to solve it. Now to make this work, there are 5 typical conditions that have been described in the literature from FSG and the Collective Impact Forum. We would add one more to that list, and so I'll review each one in time. Common agenda, this is a key part. This is the set of goals of what are we trying to change, as well as an understanding of why the problem exists today. Oftentimes, it's easy to share a vision for what a better future could look like, but there can be differing points of view on those problems. A critical part of collective impact is that you understand the problem from the same way so that the solutions that everyone is moving towards are done in concert. And an important part of that is having a shared set of measurement. This is both how we collect and measure results, but also sharing that accountability so that it's not one person's initiative, but shared community-wide as everyone's responsibility. A third, mutually reinforcing activities. This is about taking different approaches and coordinating through joint planning. The goal of collective impact isn't for everyone to be doing the same thing the same way, but to be using their unique strengths and assets together to make the change possible. To make all of this possible, communication is really a critical part, and it needs to be done across all layers, both within the collective impact actors as well as in the community as a whole. Really, this is about trust. If the groups trust one another and are willing to commit to this, it can be very successful. If there isn't that sense of trust, then they can often fall apart as road bumps come up. Backbone support, this is the 5th measure, and this is a certain type of organization or organizations that are able to support the effort as it moves forward into the community. It requires resources and skills to convene and coordinate participating organizations, as well as the trust as a neutral convener. And we'll talk about this backbone in more detail. One additional consideration that I think has been coming more and more prevalent in collective impact efforts is making sure that equity is being advanced through the initiative. Otherwise, some of the problems that are causing the challenges in our community are being perpetuated through the work, even though we all have our best intentions in mind. And so this is about having equity in mind as we look at the systems and policies as well as the community outcomes. This can start with as simple as making sure that the table that everyone is at includes everyone that might be impacted by the change. So with these conditions in mind, I think it's important to underline that collective impact is a long-term effort. It's not something that starts and immediately you will see impact. Oftentimes, from the beginning, when groups are looking at is collective impact a possible approach for us, that can take 0 to 3 months. Being ready to initiate action and gathering all of the stakeholders that will be a part of it, that can take another 4 to 6 months. Then deciding how to break up the work, what does the common agenda really look like, how are we going to move forward, that's another 4 to 6 months. And so now we're at already over a year's worth of time before any actual action has taken in terms of change. And that's really where phase 3 comes in here of sustaining that action and building the momentum for the long haul. And that's really an ongoing effort. This timeline's been assessed using kind of the historic research from other initiatives, and from our experiences, this fits quite well with what we've seen. So who all is involved? This is a messy looking chart, and I think that's in part intentionally. But this is an example of illustrating the agenda and shared metrics and how that can work. And so looking from the left side in terms of strategic guidance and support, there's often a steering committee, which is made up of the community members and leaders that are really guiding the work. And there's a backbone organization or organizations that are helping to coordinate and leverage and move things forward. Those two groups on the far left are not necessarily providing services or doing action. That can often be at the work group level, where it involves partners, whether it be nonprofit partners, funders, business leaders, public agencies, community residents. But those are the ones that are really driving the change, and that should represent the full of the community. For collective impact efforts to work really well, it's often common that there's a good amount of rigor that goes into defining what each group is doing and what their role is. We'll walk through this with Find a Ride, Waukesha County in specific in a little bit later, but I think it's important to know that the backbone organization or organizations are really the leaders that are providing that context and aligning people together. The steering committee is really providing the door opening and strategic direction and oversight. The work groups are those that are really making sure that the change is happening, creating action plans, providing functions to make sure that things are happening and connecting with the community. And lastly, the community partners that may be involved as participants on a work group level are often those that should have access to learn about the initiative, get involved if they can, and find ways to really keep things building and moving. Oftentimes, a group may start very small with a very few number of people in a backbone or design level, and then a small steering committee. And as the initiative gets momentum going, will grow and grow and grow. As an example, the Milwaukee Succeeds initiative has over 300 partners today. When it started, I believe it was close to 5 to 6. So backbone organizations. This is often a term that has a significant amount of confusion involved in it. Initially, research suggested that it should be one single organization, but after more experience has come, as this has been played out in other communities, it's found it's often better to have it be a shared set of roles across multiple organizations. And the backbone really has 6 key functions, and I'll walk through each of those now. The first is to guide the vision and strategy. So the backbone is really the standard bearer for what is the vision, where are we going, how are we going to do that, and making sure it's at the forefront of everyone's work. Supporting aligned activities. The backbone organizations do not necessarily do the work, but they make sure that the work can get done. This can be facilitating communications between partners, convening, providing technical assistance or coaching, incubating new collaborations, and recruiting new partners. This is really about bringing everyone together. Establishing shared measurement practices. This is really where ensuring that the value on data is used as a way to resolve potential conflicts or disagreements. And so how do we look at collecting, analyzing, and using data for the continuous improvement both of the groups as well as the outcomes that we're seeing in the community. This is really where we make sure that things stick and work. It may seem like a subtle nuance in terms of phrasing between this and technical assistance, but really it's about making sure that everyone is using the same types of ways to look at the problems and measure for those successes. Following those 3, the building public will is really about raising awareness and support, as well as getting other community members to feel empowered to enact the change in action themselves. This can be done by working directly with community as well as through public policy, which is really the next one of advancing policy. So on one end, there's engaging our community to make sure that they support and understand where we're going, as well as engaging our policymakers to advance changes at the systematic level that can really make change possible. Lastly, and also very importantly, the backbone organization is a key part of mobilizing the funding. That doesn't mean that the backbone is responsible for acting and ensuring the resources all come in, but they're a key part of leveraging all of the partners together so that funding comes in both for the backbone as well as for the work groups and initiatives that are taking on the challenges in the community. Some common misperceptions. Oftentimes, there's a sense that the backbone sets the agenda for the group. Really, the group is who should be deciding what that agenda is. Another misperception that the backbone organization drives its solutions. Again, this is not the case. This would be more of a typical top-down approach. The backbone organization really helps to facilitate the conversation around what the best solutions can be and helps keep people accountable in doing so. I mentioned before about funding. The backbone organization doesn't necessarily receive or even ask for all of the funding, but they do need a certain amount of funding to support their efforts as they're leading this in the community. The backbone roles really need to be appointed by the whole of the community. If there is any competition or sense of individual organizations owning an initiative, the progress that can be made as a group can really be limited. And so it's important that the backbone roles are chosen in a way that feels fair and just amongst all that are involved. And lastly, the role of the backbone, it is not fundamentally different from business as usual. That's again, this is the misperception. It is a very different type of model, and there's many different ways that backbones can be functioned in terms of their staffing, time, and resources, and what that success can look like. So when looking at the impact of a backbone organization, there's a couple different places to look. One, are we leveraging more funding to be provided for the initiative so that at least in part these efforts can be redirected in ways that fit the common agenda? Are we seeing progress on our initiatives, whether the number of partners involved, legislation being passed, qualitative feedback? Systems change. This is again that big picture way of how are institutions operating in different ways, and what does that look like? And then a community-wide perception of the value of the backbone and looking at whether or not it's contributing to the community. Commonly, backbone leaders are described as visionary, results-oriented, collaborative relationship builders, focused in terms of being able to keep the direction moving forward, but adaptive as change can often happen, charismatic and influential communicators, politic, and humble. Those last two, again, I think it's a key. It's about understanding the big picture, but not taking responsibility for all of the success. And so that's really how do we bring the whole group together, understands the fit and the dynamics, and can really lead it moving forward. So given that context of what collective impact means on a conceptual level, the next part of this presentation will be focusing on the Find a Ride Waukesha County, which is really about transportation access to health and human services. So I'll begin with a broad overview of the problem and challenge, and then looking at how the collective impact effort has evolved to date. Waukesha County is well known as being a community full of assets that contribute to our well-being. Looking at the health factors from UW's Public Health Institute, you're ranked #2 in terms of the number of health and the outcomes, which is how long people live, #6 in Wisconsin, and this is really a result of the strong school system and highly educated population, strong set of clinical care networks, advanced job sector, low taxes, public parks and nature access, and the broad leadership from across the community. One area that's important to note is the physical environment, which rated 70 out of 72 in the counties, and that's really a big part of looking at where transportation and transportation access fits in. And so although Waukesha County does have so many wonderful resources, if you do not have reliable transportation to reach them, your ability to access it will be severely limited. Waukesha County is almost 600 square miles, includes areas that are suburban, urban, and rural, meaning that there's really no one system that can solve this transportation problem for the entire community in a way that would be practical or efficient. Efforts to address transportation have been in place for over 25 years with limited success to date. And so the overarching vision for Find a Ride Waukesha County is that all residents in Waukesha County have access to the assets and resources necessary to have meaningful lives. And what does meaningful lives mean? That's the physical, mental, emotional, and social well-being of our community. And to that, there are 4 critical pillars necessary for achieving and maintaining access to health and health services, employment, education, and community activity. And again, without access to these resources, individuals wouldn't be able to have the meaningful lives that are possible for them. So that is an ambitious agenda in terms of the scope and the population. And so here is a chart that kind of describes where we are beginning with Find a Ride Waukesha County. And you'll see on the left side in the rows are different population groups, seniors and adults with disabilities, adults more broadly, as well as youth. And then across the columns are those pillars that we discussed: health and human services, employment, community activities, and education. The focus of Find a Ride Waukesha County is really on the health and human services for seniors and adults with disabilities. I'll describe why that focus is centered there in just a bit. But it's possible that as the success of this effort moves forward, that other collective impact efforts could begin to focus on some of those other areas, whether it be other areas of seniors and adults with disabilities, other adults and youth in a different function. But again, the gears and focus today are on the health and human services for seniors and adults with disabilities. And the steering committee will really be the oversight function to make sure that both the circle in red is effective as well as the broader initiative. So why this initial focus on health and human services? This is already a major challenge. Over 1 in 2 seniors surveyed in Waukesha County reported difficulty with getting their transportation, and the population growth of seniors is going to really be doubling by 2050. It's already at a large percentage of the population, and so it's an urgent issue today. But action now can really transform those outcomes and really get ahead of that curve as the population is growing. When we look at the transportation system, there are many important players, whether they be in the health services, social sector, healthcare administrators and providers, the government, business has a role in it, the community and caregivers, as well as other outside influences like funders and community advocates. The transportation providers are really the connective tissue that can get riders, in this case seniors and adults with disabilities, to those other assets. And the costs of those service gaps, when they do not work out, are felt across the entire system. Everyone has a cost that's associated with a failed ride or the lack of transportation. The challenge has been that to date, the focus and role of any one organization or provider on this list is not to make sure that those rides happen successfully. And that's really the effort that the Find a Ride Waukesha County is focused on, is investing in that transportation system. To do that, they're developing a cross-sector work groups to engage the community and steward that impact. At the top is that steering committee level for stewardship, and then in a community engagement level, communication more broadly. We're also connecting with riders and lived experience, transportation providers, and other community partners. And then on the bottom, in the orange color, the backbone support and management, this is around the technology and operations for the system, as well as measuring the success and generating and acquiring the resources necessary to be successful. The steering committee, as it's been proposed to date, will include leaders from across the sector, and I think this is a real strong point for any effort, is that it is fully representative of the community. So it involves business members, community members with lived experience related to being senior adults or with transportation challenges, county government, healthcare, local governments, cities in this case, nonprofits, philanthropy, as well as the transportation sector. The second list, which I won't list out in specific, includes some of the steering committee organizations that will be involved, many of the health systems, many of the funders, many of the county government are all going to be involved as a part of this initiative to drive this success going forward. I'm including this slide again around the 6 core functions of a successful backbone organization, just as a reminder. Again, guiding the vision and strategy, making sure that this is moving forward, supporting the activities of all of those partners to make it effective, establishing shared measurement practices so we can learn from our successes and challenges and move forward and improve, building the public will in the community, advancing policy from policymakers, and mobilizing the funding necessary to make this successful. When looking at the backbone roles, Interfaith has a role in nearly every part of this initiative, but each group will involve a substantial number of other partners. Specific to the backbone, Interfaith, the Transportation Affinity Group, and Thriving Waukesha County Alliance will take on the primary focus of the backbone organizations and functions to help move those forward. Those other work groups that we mentioned will each play a specific role in terms of making the collective impact effort successful. Now, given that this is a large number of groups between the backbone functions, the steering committee, and the work groups, I believe there's 9 different functional areas to be focused on. And so as a timeline, the backbone team and the steering committee are intended to begin starting early Q1 of 2017. And then from there, evolve and advance future groups focused around communication and infrastructure to help lead this forward, with the goal of becoming fully operational with all of the work groups by 2018.